So how do you determine a due date?
So a due date can be determined one of two ways. If a patient has regular periods, you can go off of when the first day of their last period was.
Okay.
Because usually once a patient gets pregnant, their periods stop. So you can predict a date from the first day of their last period, and then we still always ultrasound patients as early as possible in the first trimester. So if your due date based on the ultrasound measurement of the baby at the time of the ultrasound kind of matches within a week of the predicted date of the last period, then we actually go with the date from the period.
What equipment do you use for a prenatal visit?
It depends what they need to get done that day, but sometimes it's just as simple as a stethoscope and a Doppler machine to check the heartbeat. Obviously, if they're having an ultrasound that day, we use ultrasound, but it's actually a lot of simple stuff. And then blood drawing sometimes.
And do any mothers, are they concerned that the equipment might harm the baby in any way, or?
So that comes up every once in a while, especially now that there's a trendy thing to buy a Doppler machine to hear the heartbeat at home. And so with those types of things, it comes into question of how often is it okay to do this safely. We certainly recommend that patients actually don't do that because if you ever have a concern at home that you can't find the heartbeat, it's not something you should manage yourself. It's something that we should be managing with you.
Right.
And maybe there's moms that want to do that every single day, and there really haven't been a lot of studies to show is using that machine every day, because it is an ultrasound that can sometimes cause heat waves to the baby, and we're not sure if that's safe. So we actually tell patients not to use that
That's
and
good
just
advice.
stick to what's in the office.
Okay.